and I'm the center lead for the Center for Data Science and Social Impact, CDSSI. We are very glad you could make it here today, despite it being a weekday evening. What we have put together today, we hope will set the stage for some insightful conversations and collaborations in the future. First, for those of you who are unaware, let me tell you a little bit about ISDM and CDSSI. ISDM, or the Indian School of Development Management, was started in 2016 as a first of its kind institution dedicated to the discipline of management for the social sector, which is the discipline of development management. ISDM has three key pillars. The first is its flagship postgraduate program in development management, which aims to evangelize the discipline itself and create high quality management talent for the social sector. The Global Knowledge Hub is the second pillar, which works to catalyze an ecosystem for teaching, learning, and practicing development management across the world. And strategic capacity building is the third pillar, which provides support in building the capacity and effectiveness of the sector. Within the Global Knowledge Hub, there are three centers of excellence that focus on different areas of development management. The first is a Center for Philanthropy for Inclusive Development. The second is the Center for Innovative Finance and Social Impact, both of which are based in our main campus in Noida. And in Bangalore, we have the Center for Data Science and Social Impact, or CDSSI, which aims to create awareness about how social purpose organizations can use data and data science for decision making and transform their impact, efficiencies, and scale. We will paste our website link for you to look at to know more about our work. And we'd love to hear from you at any time if you would like to work with us or understand what we do a little better. Today, we are here for the CDSSI convening on data science for social impact that draws from our own secondary research on the landscape of data science use in the social sector. This convening is intended to act as a launchpad for building communities of practice among social purpose organizations who want to use the power of data and data science to scale up their operations, program interventions, and impact. We are truly overwhelmed by the number of participants today. There are more than 150 registrations. To streamline the experience for all of us, just a little bit of housekeeping. I would request all of you in the audience to please use the Q&A box at the bottom of your screens to engage with us and with the panelists. Today, we have two panel discussions, and my colleagues will shortly tell you about the panel discussions and what they are about. You can, of course, send in any feedback or thoughts you have, both on this convening or any other, anything else you would like to tell us about through email on cdssi@isdm.org.in. Without taking any more of our time, I think it's time for us to jump straight into the panel discussions. I hand over to my colleague, Anirudh, from our research team. Anirudh, over to you.
Thank you. Thank you for the introduction, Shweta. And thank you for setting the context as well. If I could just change my slide over here. Sorry. Perfect. So thank you once again, everyone, for joining. It really means a lot that you've taken the time out of your day to join us on a weekday. Thank you to the panelists as well as all the attendees. So just building upon the context that Shweta had said, the research that our center has conducted over the last couple of months has helped us shed light on how SPOs, which is social purpose organizations, are increasingly turning to data-driven approaches to inform their strategies, to deliver their programs, and to measure the outcomes and the impact of their programs. And then building upon this premise, building upon this foundation, today our discussion, we'd like to delve deeper into how data science is being used by SPOs in India. So our first panel discussion for the day will revolve around the theme of how SPOs can leverage data science to enhance their functioning and to amplify the outcomes and impact of their work. Specifically, we want to explore the specific benefits that an SPO can derive by utilizing data science. We'd also like to understand the challenges that SPOs face while utilizing data science. And also, based on the very extensive experience of our panelists, we'd love to hear some best practices that they would recommend for other organizations that would like to leverage data science. So with that, I'd like to introduce our first panel for today. We have Karuna Raina, who is the Director of Public Policy and Research at SaveLife Foundation. We have Uday Adavi, who's the Global Data Science Lead at the George Institute for Global Health. And we have Akhil Rokade from Tata Trusts, who's working as an assistant manager with them. So I think with the very extensive experience and the wealth of knowledge that our panel brings, I am confident that our audience will derive a lot of valuable insights from this discussion and take home a lot of learnings as well. So without further ado, I would like to jump into the first panel discussion for today. But before that, if I could just request my panelists, maybe starting with Karuna Raina, if she could just give a brief overview of what the SaveLife Foundation does, and then we could get into the specifics of how it utilizes data science. So Karuna Raina, if I could just request you to give us a brief overview of what the SaveLife Foundation does.
So thanks, Anirudh. Thanks for inviting me for this panel discussion. It's great to see all different participants and the audience speak about this important issue. I think it's even more important that as civil society, we discuss the need for using data science and technology and see how both can be integrated to not just figure out solutions, but also to define the problem we have at hand. So just to take a step back, I would first like to introduce SaveLife. SaveLife is a 15 years old organization, and we've been working only on one issue, and that is road safety and emergency care. And that's because there's a huge number of people in India who step out every day to do normal stuff, to go to college, to go to school, to go to work, and don't come back home. Every year, 150,000 people die in road crashes in India, and a lot of them are preventable crashes. And so it's really a public health issue. It's number one killer of children in the age group of 5 to 15. It kills more people than tuberculosis, malaria. And so we really want to make sure that we are able to eradicate this as much as we can. And the strategy we have is twofold. We look at both pre-crash, what can be done by way of reducing or mitigating various crash contributing factors on Indian roads, and how can we enhance the quality, access, and care provided, the post-crash trauma care. And as part of that, one of the key things which we have done so far is to look at frameworks which exist. So we filed a public interest litigation in the Supreme Court to ensure that the Good Samaritans who come forward to help road crash victims, they are protected. And a lot of that work involved looking at data and describing the problem in a very scientific way, so that we are able to also communicate the problem objectively and not just in a very subjective manner. We further worked with the Government of India to strengthen the Motor Vehicle Amendment Act, which is a road safety legislation in the country. And on the project side of things, we have a flagship program is called Zero Fatality Corridor Solution, and we work with various state governments and the central government to reduce road crash deaths on high fatality corridors. And we've recently adopted roughly 100 districts to see if we can translate that success also in the districts. So that's just a gist of our work.
Great. Thank you so much, Karuna. And we at the center have actually been doing a lot of research, trying to understand some of the initiatives of SaveLife Foundation. So it's very interesting work and definitely a very pertinent problem to address. Next, if I could just ask Uday as well to give a brief introduction.
Thanks, Anirudh. Thanks for inviting me to this panel discussion. Very inspiring to see a lot of interest in participants joining this discussion, and that's always exciting. My name is Uday. I'm the data science lead at the George Institute for Global Health. I'm based in Australia, but we have offices in India, UK, and Australia. So the George Institute is a health research organization, and we work on conducting research for better treatments, better care, and building healthier societies from a global health perspective. And we have a lot of programs that get funded by a wide variety of sources and from grants. And we work primarily across low and middle income countries, addressing non-communicable diseases, diabetes, hypertension, cardiovascular. So a lot of like subjects like that. So it's, being a health research organization, so the George Institute has traditionally been very strong with statistics as a practice, primarily in clinical trials and study designs, and it's a very mature practice. Over the last 2 years, though, we've seen a strong rise in demand for AI-driven and machine learning-driven solutions, and this led to us creating a central capability for data science. And as we speak, we are looking to grow this capability. And when we think of machine learning and data science, we think of applying it from two perspectives. One is ML as a tool for analysis. So if you're doing any retrospective analysis, and it could be any data set, it could be data sets from research programs, or it could be routinely collected data, which has a lot of rich information, and we have large data sets globally as well as in India. The second is a more interesting one, is machine learning as an intervention. So this is where we're looking at applications of how do we assist humans with their processes. And this can range from trying to provide tools where there's human judgment involved. And we've seen a lot of growth with generative AI tools recently. And we are doing a few projects in India that are working with generative AI and applying in a low resource context. And so it's a machine learning as an intervention where we are looking at creating chatbots and LLM-based interventions to help in better health outcomes. So that's probably a very quick overview, and we could explore more in detail as we go through.
Excellent. Thank you. Thank you so much. It's very intriguing applications of AI and data science to public health. And we'd love to dig deeper once the discussion starts. Akhil, if I could just request you maybe to give an overview of the work that Tata Trusts does.
Thanks, Anirudh, for inviting me for this discussion. Right. Tata Trust, it's one of the largest philanthropic organization in the India, right? And it has around 16 portfolios, different portfolios, which are working in the segments of nutrition, health, digital transformation, and education. And I am working with one of the particular portfolio, analytics insights on impact of Tata Trust, which primarily deals with digital strategy consulting to these horizontal verticals, and help them design in their data strategy, help them design in their system and implementation, manage their data sets, and I would say effective monitoring. And on the each segment from design to the impact measurement, we play a crucial role working with these verticals. So yeah, that's the brief profile of analytics insights and impact portfolio where we do. And as we move forward, we'll get into details on the same.
Great. Thank you. Thank you so much, Akhil. And we'd love to know more about the data strategy aspect of things. If I could just request the audience, if you have any questions, please leave them in the Q&A box instead of the chat. We'll collect all of your questions in the Q&A box, and after the session, we'll pose your questions to the panelists. So with that, I'll move to our first question. So in the same order, so Karuna, right now, what we have sensed is that in the sector, there is a very abstract understanding of how data science can be used. People do realize that it is beneficial and there are certain advantages that can be derived from data and data science, but we'd like to get into some specific benefits that SPOs have derived from the use of data and data science. Some very tangible sort of benefits. So if you could describe some of those for us, I think that'll be a great start to this conversation.
So definitely. So based on our experience at SaveLife, Anirudh, what we've been able to sort of, over the last 15 years, if I sort of have to look at that journey and how data has helped us, one is to state problem in a way which is acceptable to all stakeholders. As our strategy and as our scaling philosophy, we believe that we have to work at scale, and for that it's essential to work with government. And we do a lot of fairly sort of, good amount of work involved around creating frameworks, both at state level as well as national level with the government. So what data does, and I believe that would do for any other, nonprofit, would be to establish the problem and articulate the problem in a way which can be then, portrayed in a way in which it can be solved. So, for example, in 2012, when we started working on the Good Samaritan law, one of the key things which we heard from different people, including policymakers, was that people don't help road crash victims because there's general apathy. And of course, there have been a lot of videos which have been circulated, of people just standing or, stealing things from people who have been involved in crashes, general apathy. But that's anecdotal evidence. When we went on ground and we surveyed people and we collected data, we found that 80 to 85% people were not helping because of legal and procedural hassles. Because they were afraid that when they take the person to the hospital, they would be asked to pay for it. Because it's a medical legal case, then they would be asked to be a witness, or in fact, even more, they would be, accused of causing that crash. So it helps define the scale of the problem and therefore what needs to be solved. And when we were able to define the problem, we saw it very clearly that what we need to provide is protection to Good Samaritans, that they should be insulated from any kind of procedural or legal hassles. And therefore, when we filed the PIL in the Supreme Court and we were able to, take that to the Supreme Court, we were able to guarantee that kind of protection for Good Samaritans. And of course, even now the awareness is low, and I'm not saying that the whole problem is solved, but overall it helps you define the problem. And what it helps after that is to define the scale of the solution and track your solution. So if I'm able to say that in 2016, the awareness of the Good Samaritan law was just 16%, and I know in 2023, it has only increased to 21%, I'm able to track what has been the success, or what has been the delta, and therefore what all needs to be done. And that's purely from a policy framework point of view. If we look at on-ground implementation, again, it helps us define the problem. It helps us look at how we can solve various issues. So, for example, one of the key issues that we have found on the corridors where we are working is of rear-ending crashes, and it helps to know if that's your key problem, and therefore what tech solution can be deployed. So we deployed drones mounted with AI technology, which could then just make announcements, and somebody sitting in a control room could just look at it. And then that gives whether that, and it helps you to also know whether that solution is working. And if you have to fail, you fail fast. If it's a solution which can be scaled, you can scale it. And then you can take it to the government and say, yes, this is working, or no, I need to tweak it, and therefore what needs to be done. So instead of just being a theory or just being, a conjecture which you want to test out, it helps you test that out and you're able to deploy it. So I feel that's a very clear, tangible benefit, which can be sort of, employed and deployed by any nonprofit, whatever sector they are working. And even with the different things which different organizations are doing, I think it helps to, there's such acute lack of skilled manpower in this sector because of n number of reasons, and I'll not go there. I think it also helps to sort of then bridge that gap in some way, be able to use various technologies to be able to do different kinds of things, automate and semi-automate certain processes, and be able to take those solutions to scale.
Excellent. Would you be able to highlight some areas in which cost was reduced or efficiencies were increased through the use of data and data science?
So definitely. So one of the things which we do is we we audit roads wherever we are working, the zero fatality corridors and districts, and we do audits across all different areas. So engineering, enforcement, and emergency care. And when we traditionally used to go for an audit, it was a team of 5, which was going, and they were looking for different factors, right? And once they used to come back, they had to look at the video footage for hours to be able to first figure out, document what was wrong, then B, verify and QC. Now, if we are able to, automate or even semi-automate that process and still do manual verification, we're able to expedite that whole process. And I think that same thing is happening with the government. There were manual challans which were happening. And now since we moved to electronic enforcement, the volume of challans which they are able to generate and has increased a lot. And they've also been able to do it for various other risk factors. So for example, one of the key 30 or 40% of people die because of non-usage of helmets. A cop cannot be everywhere, and there's only so many traffic cops which are going to be there in the country. So what electronic enforcement helps is to do it 24/7, do it without corruption, and be able to do it objectively. And of course, at the end of it, there's still manual checks because, no technology is foolproof. You will sort of mix up the number plates and everything. And there is a backend which is sort of still being figured out at various levels, and the system is being made interoperable, and of course, a number of things. But it has helped to sort of, look at that problem of how various risk factors need to be enforced when it comes to road safety.
Great. Thank you so much. Our center uses a framework which is strategy, operations, and then program delivery, and then evaluation. And I think what you have highlighted is that your work or your data science work touches upon each of these elements. So that's very interesting. We can get into that a bit more. Akhil, Uday, if I could request you to.
Sure. So one of the main lens as part of our data strategy, like data science strategy we apply, is building capacity. So we want to apply data science and AI techniques that can help build capacity, and that can be at different levels. So we spend a lot of time in problem formulation and framing. Exactly like the framework you mentioned at the start part of it, and that's where I play a role here, is sitting with researchers across different health program areas. We come to the table from a perspective of what are some of the gaps in that particular research program area? What does the data science techniques can do for them? And then we try to frame a problem. And a lot of times we're thinking from a capacity perspective, and I'll take an example, right? So say you have a radiologist who's looking at scans of brain images. And they look at a sequence of scans over the last 18 months, and then they make a judgment on a diagnosis or a prognosis. And traditionally, that's very, very highly specialized skill. Now, there are parts of that analysis and judgment that a radiologist does on these scans that an AI augmented solution can help with. So could be just segmenting parts of the brain for you, or highlighting spots. So there is an element of supporting the capacity of a radiologist or any clinician that can help them do their job better, thereby building capacity for them. So a lot of these are currently in train and are like multi-year projects that we are involved in. And I can take another example of building capacity. There's a proof of concept right now going on in Telangana and Haryana, where we are working with frontline healthcare workers, ASHA workers, and we're trying to build their capacity from a clinical knowledge. So we're trying to build a tool for them. So whenever they have any questions while engaging with a pregnant patient, they can actually refer to a chatbot for quick answers, which are based on Indian standard guidelines. So they don't need to go back to their primary health center doctor, or refer the patient to the doctor, and there's delay in the care that they can provide. So the metric here would be a better experience for the patients, as well as the frontline healthcare workers are able to more confidently handle, how many patients are they able to handle, and how well are they able to handle. So that's from a research program perspective. And we work across different disease condition areas. There's another aspect which is also growing, is the organizational aspect. So we have different enterprise functions, and we are starting to lay the ground in terms of what are those use cases. So I'll take an example of, there's a manual process where there's a data quality manager who looks at certain output from a system, an internal system, and the output from this goes to the board every quarter as a report. So it needs a lot of effort, and typically takes about 2 weeks to the whole data quality exercise. And when we sit together and conceptualize a problem for this, so it's a text-based classification and an NLP problem, where given a particular piece of text, you can actually classify whether all their details are available or not. And you can formulate and then build a process out of this and automate it. And we've seen that there's easily the 2-week process can be reduced to like a few days, where the work then just becomes validating an output from the system rather than checking every record to so that's significant operational efficiencies. And I think that's a lot, like putting all of that together. So I think of operational efficiencies, innovative solutions, and augmenting human intelligence, all in all, helping with building capacity. I think that's been a focus area for us.
Great, thank you. Thank you so much for sharing those very specific examples. So I just had one question about the example you shared, in which you're trying to build the capacity of frontline workers, such as ASHA workers, ANMs, etc. So how does one go about measuring the success of these interventions? Is it about an increase in their knowledge, or is it an improvement in the health outcomes of the community?
Yeah, it's an interesting question that we are trying to work through ourselves. And there's a question we ask ourselves, is what is the baseline? So we have a tool, and the tool is helping us, but what is the baseline? The baseline is we don't have a tool, and they are consulting with the patients as is. So we've captured some pre-information for this, but you're right. There's more aspects to this than just how many patients have you handled, or how much time are you taking per patient. I think those metrics don't do justice to measuring, because they are not necessarily indicators of success of learning. So one way which we are also testing is testing the knowledge. So we've done some measurements of knowledge through like a questionnaire, and then post we're looking at, and a lot of this is also happening under supervision. So because it's still proof of concept, and we want to do this in a responsible way, we've not yet rolled it out to in a live scenario. Right now, we still have ASHA workers testing this, but in a very supervised manner.
Thank you. Thanks for explaining that. Akhil, if I could request you to share some specific benefits of the work that your division or other divisions at Tata Trusts are doing.
Yeah. So see, as I mentioned, that there are multiple portfolios which are working on different interventions, and the problem statement like that each portfolio has like a number of programs on the ground, and they're dealing with the data. Prior to 2016, all this exercise was basically, on a traditional pen and paper based methods, right? So I'm giving you an example of a program which was in partnership with the government of Maharashtra, which was Village Social Transformation Foundation. I personally led that program. So the objective of the program was to basically turn 2,500 villages into model villages. on model villages fetches the parameters for a model village from SAGI guidelines, which are Sansad Adarsh Gram Yojana guidelines, which is around 120, 30 parameters around water and sanitation, education access, road, infrastructure, individual level informations in terms of, financial inclusions and all that. But then, if you look at the quantum of this program, it was around 15 districts, 2,500 villages. And by the time you collect that information, the information is processed. For that, you conduct capacity building of the ground staff, right? And then they go to the field, they collect information, come back. The information has been processed by someone. There would be some corrections, there would be some quality checks, and then it will be reflected for decision making and action. By that, we average it out, it comes around 6 to 8 months in the overall process. So by the time you're getting the information, it's already outdated. So what we did, we realized that this is a bottleneck. The way we book an Ola, the way we use, these marketing companies are using your data to recommend you better products for your interest areas. Why can't these information be used on a real time basis, right? So what we did, we tried to create a framework which is Delta. It's data evaluation, learning, technology, and analysis framework. So we divided the overall process of any planning exercise, which is it is health, nutrition, any. It starts with defining some success parameters, then defining some questionnaires. People go on ground, collect that information. Then there is a process of cleaning, then there is monitoring, and then finally you basically reach out and an action plan to maybe district administration or maybe a portfolio vertical head, right, or your partner organizations. So based on these parameters, we try to create a framework and which eventually turn into a public good tool, which is a technology IT tool, a mobile based application. So the tool works in a fashion that the problem statements were that in most of the geographies you don't get the network access, so we needed an offline tool. And perhaps while you conduct those capacity building session for these people on ground staff, it is important for them to basically understand the uh, objective of asking a particular question, right? The app should basically, and we realize that most of the time errors happen at the ground itself because of the reason either the person didn't understand the training, or maybe there was a gap in asking the question, responded in a different manner which was not expected, right? So most of the time error happens at the source level itself. So what we try to define app in a manner where you can customize it with some checks and balances and constraints at the source level, so that if a person has selected gender to male, he'll be guided for the male questions. Age is 60. As you populate the information, the app will basically take you to the particular specific questions on this. This way, we reduce the errors at the source itself. Second, we try to capacitate the ground staff for the monitoring. We define those quality checks parameters which are non-negotiable. So once you have data errors, you rectify those data errors. But then there are logical errors also. For example, if there was a gap in training, I'm sharing a real-time example of the particular project where we received gender as a third gender for a particular geography, which was around 60%, 50 or 60%. People have responded third gender for 60%. That was a flag for us, because a person who is monitoring it, they could see it on dashboard and they can immediately reach out to ground team and check for the information what was the reason. We realized that either there was a gap in training, or there is a need to basically conduct a refreshment training for these guys, or there was an I would say understanding gap on the ground, right? So this way we reduced error at this level also. And then finally, most of the time we work with the district administration, such as district collectors. So what we tried to provide all those access of dashboards to district collectors, and then we basically used to reach out to those geographies and conduct meeting with the line departments and the district collectors on those particular systems, so that they are well averse and capacitated on the use of that tool. So, I mean, this is how we functioned, right, for that particular project. But then we realized that, within Trust itself, if you look at the ecosystem, there are so many programs, and each vertical, I mean, there is, I would say it is very difficult to create a synergy between these verticals also. So nowadays, what we're trying to do, we are doing that, if there is a common geography and a particular team is working, for example, health is also working there and education team is also working over there. There has to be a bridge between both of them, because at some point of time, target audience is the same. Outcomes expected are the same, right? So can an existing program's data or information can be helped in, increasing the efficiency or effectiveness of the another program which is being deployed on the ground. So yeah, I mean that's how analytics insights and impact team functions, and we basically work closely with this education team. We work closely with nutrition, health, and we try understanding their programs with the lens of programmatic objectives, as well as with the lens of effect, how we can effectively create some frugal innovation for them, how we can leverage, maximize the use of existing tools or resources which is within the ecosystem, to increase the efficiency of their program.
Great, great. Thank you so much. Now, I'm sure this would have been very valuable in terms of increasing efficiency, reducing errors, and overall improving the data quality as well. And as you said, promoting synergies between different divisions. Just my question to that would be, so this seems like a very complex, multifaceted kind of a solution, right? So, and I'm sure Tata Trust, an organization like Tata Trust, has the capacity to implement something like this. But would you recommend something like this for a smaller organization as well?
So, Anirudh, it's an apt question, right? We also realize, no, it's not only about Tata Trust also. I mean, if you look at, as I highlighted, there are multiple portfolios, and each one is designing their own system. It happens so. You cannot provide a one fit solution for every every program, right? So, that was also a problem statement for us, because a vertical will be expensing out huge money on a particular designing the similar kind of system. Hence I highlighted on the very first, when I was initiating Delta, that the overall process remains the constant for the program, right? You collect information based on some parameters, you do some quality checks, you must have some quality parameters, right? Then why to reach out to the partners for every time designing a new system? You create a framework around it and let the program team customize that framework and tool as per their requirement, because everything
Right.
fits on these broad buckets, right? So the objective was to create a public good itself. So we are still working on it. And when you look at these smaller organizations, I mean, I have interacted with uh, on ground organizations and realized that they are facing the same issue. They use the traditional methods. Even if you go and then why don't you use an freely available so survey CTO or any other Google Forms? The problem is that the hesitation to get into something new which basically they've not used earlier. So it is important to build the capacity around those things, make them familiar around these segments, and I am sure the uptake can be increased. There are very, I would say, readily available free tools on this. But I mean, at the end, the traditional method, the method of digital collection, it optimizes the overall program and process. It increases the efficiency in terms of, at least the reduces the programmatic cycle of operational cycle. So we at Trust also creating this tool with an objective to create as a public good for the sector.
Great, great. Thank you for clarifying that.
Yeah.
So just wanted to get into my second question now. So Karuna, if you could just shed some light on some of the challenges that nonprofits face while they try to integrate data science in their operations or in their program delivery or other aspects of their functioning. If you could shed some light on those challenges that you have faced at your organization, or you have seen other organizations face, and maybe share some recommendations on how to overcome those challenges.
Sure. So one of the sort of key challenges which we still continue to face is the quality of data which we receive, or the quality of data which we have to work with and make sense of. And so I think I'm sure that's a constant for a lot of organizations as well. So what we receive in terms of national, let's say road crash data, injuries data, overall, how it gets collected even at the state level, district level, I think that's a huge sort of challenge which we have faced. The other sort of linked challenge is how data gets collected at different levels. So to give an example, we were working with a state government and we were trying to heat map a particular district to understand where are most of the crashes happening. And we found a really like a very hot zone, and it was an outlier, and we were very unsure of what is happening. It was in the middle of the city. And when we sort of looked at the GPS coordinates, we found it was a police station. And that's when we realized crashes can't be happening in that police station. So there's clearly something wrong. And what we figured out was that the cops were using their diary, their normal sort of way of taking down the notes on site, and the data entry person was doing the entry at the police station, and the system was automatically taking the GPS coordinates of the police station. So there are those challenges as well, which need to be sort of resolved in terms of how the data gets collected. What seems very common sense might not be, it's very different for different people. So certain ground rules and everything needs to be clarified in terms of, and you can't assume things. So how the collection happens, how it's treated, and how it's then looked at as something is a challenge which you're trying to sort of, also streamline the processes around it. I think there's also a lot of larger awareness also within the country and the overall ecosystem in terms of how data is collected. So I think that's also sort of moving in the right direction. The other challenge which we face is in terms of how data is then used to do analysis, and what kind of analysis makes sense. So like if we are trying to define and sort of figure out the problem and what is then the solution, and if it's a sort of, let's say if it's an issue requires different departments or different ministries to look at it, how the solution is sort of looked at and how the data is then looked at is viewed very differently. So I think that's also another part of the problem in terms of how do we collect data and how do we present it therefore so that it makes sense. So these are two things externally which we face in terms of the challenges. Internally, I feel it's just a huge skill gap in terms of people who are currently working in the sector, and there are not a lot of people we have found so far who are very efficient with data or who know how to work with it. So yeah, I think a lot of talent which we have seen is towards the work, would like to work in, traditionally in the corporate sector. So there is paucity of talent to work with in the sector and sort of stay in the sector to sort of make any tangible difference, because a lot of projects have very high gestation periods, and it's not like 1 year turnaround time. So that's an internal challenge, I would say, which we have faced working on this particular issue. Yeah.
Okay, great. So given that the supply of talent is definitely an issue, and that shows up as almost a constant theme in our research, what would you suggest a new non-profit organization that's trying to integrate data science into their work? Should they try to build capacity internally, or should they hire external help from consultants? What should be the approach?
I feel a lot of things can be done. I mean, at least as a stopgap arrangement. So, for example, if your portfolio of the way you're working is very CSR oriented, so then a lot of resources can also be extended by the CSR partner. I mean, if they have like, that could be explored as well. If their team would like to volunteer, would like to work, especially if it's a tech firm or, a firm which is using data, and these days everyone's working with data. So you definitely find a good pool of people who would be able to sort of, find that passion for your sort of issue and be able to work with that, or at least create systems within your, organization to be able to work with that. Second note, of course, I feel would be to also work with a lot of colleges, IITs, others, NITs, to be able to, get interns and other people. And a lot of work, at least at our organization, phenomenal work has been done by interns who've been very passionate about the work they're doing, and have, come up with solutions which have been amazing. So I think there's a lot of young energy and a lot of thought which they have in terms of how a certain solution could be used, and new thinking. So I think that could be explored. as well. And I think as organizations which are sort of, coming together as coalitions, and almost all, in the entire sector, I think each issue has one or, even multiple coalitions. So coalitions could, look at, talking to various philanthropic organizations to support them specifically, on this particular issue area, and see how that whole sort of, practice can come together. The whole community of practice can come together and look at data as a specific set and work towards that. And I'm looking at Akhil right now, and I'm sure he will also be talking to his other colleagues in the philanthropic world to, to take some sort of steps towards that, because I think it's very important. And I think a lot of work which organizations are doing can be scaled very rapidly with that kind of skill set.
Absolutely. And the coalitions part is very interesting. We've seen a lot of examples from the West where people are tapping into those collective resources, but somehow in India, that's yet to pick up pace. Uday, if I could just ask you to maybe share some challenges that George Institute has faced and that you've seen in other organizations as well, and some approaches for overcoming those.
Yeah, sure. Firstly, I think Karya captured quite a lot of them, and I had a bit of deja vu moments when she was talking through some of the challenges, and been there in those situations several times. I'll touch on something which is very close to me. So when you're just starting out to build a data science or an AI program, and everyone's talking about it and everyone says it's impactful, and you kind of feel a pressure that you have to deliver on something. Let's say you want to build data science at a small scale org. You want to do it, but there's no one backing you with funds and resources. So what do you do? How do you bring this to life? I think that's a challenge, which we've recently gone through as well. Is everyone says yes, yes, in AI in health is a booming area. We should be doing it, but no one's willing to lend a resource to do that. And the path to that is, intuitively very simple. It's start small. Don't aim for a big bang. Don't wait for someone to give you $1 million and say, hey, go build this AI function. I trust you. It's take something very small. Look up to your mission. What's the mission of your organization? And look at the whole value chain of your mission. How do you attain your mission? Then there's certain activities, certain drivers for it. So, and you kind of have to start framing problems where a data science-led approach can help. And you'll have to create a catalog of these problems. And the best way to do this is you co-create this with a cross-functional team. You can't solve all of this on your own. So you won't have a domain expertise in a particular field. So this is where product managers, project managers, so other functions within your organizations, you kind of have to have a squad together, brainstorm, take 10 problems where you think a data science-led problem can help with your mission. And then it's simple. Rank this by what's the impact? What is the expected impact? And of course, you can take some guidance and take help from people who've done similar things at other NFPs. But I think the key is you have to frame problems. You have to prioritize them and aim for something very small. Do that well at a small scale. Do that and deliver this. Demonstrate the impact in a practical way. Build a tool that can show you the impact. And it can be a very low scale proof of concept to show that. But an exec or someone, a funder, has to see that impact. They have to see that. And it can't just be in a few slides. And once you can relate with that, I think that's when you'll get more ideas. And that's a self-fulfilling prophecy from there is you'll start getting more ideas. You'll get more impactful ideas. You'll start to get investments as well once you've demonstrated this can work. And I think that's what even funders are looking for is, right? They're looking for, is there an impactful idea here? Can these guys deliver it? And I think that's problem framing, and how do you get to starting small and make your case from there. And we've had a similar journey in the last 2 years. I joined and we had nobody in my team, and we built a few proof of concepts and some really impactful solutions. And right now we are fortunately at a stage where there's buy-in from leadership to be doing more in AI, which is a very strong signal.
That's great. That's great. So for an organization that's just starting out, maybe smaller scale, smaller scope, and low cost would probably be the best approach.
Yeah, and take help for sure.
And
take help for sure. Yeah, I'm pretty sure there's other organizations who would always can just consult for you on a part-time basis, right? And that's all you need.
Right. Thank you. Thanks. Akhil, if you could shed some light on some of the challenges that an organization faces.
Yeah, I mean, I would echo with what Uday was trying to say, right? I mean, it's not important to basically, look at the big systems every time, right? I mean, there are some solutions which can be, I would say those are there is a term frugal solutions, right? We can look at the existing resources and can modify them to, and but at the same time, it is important that that collaborative, innovative approach within the team or maybe organizations is important, where you brainstorm and find out that what is the apt solution for a particular thing. The challenges which I faced in terms of data, if I say, even being a large organization or an organization which is working on the field, administration always has data, right? But the problem is that that data, though they have that data, either that data is outdated or that data is a siloed data. I mean, even different departments also don't have a connection between those data sets, right? So if we are trying to intervene in a particular geography, it is important you make a story out of that data. So the most expenses, if I look at a partner organization in terms of who's working on a ground or smaller NGO, the biggest expensive part would be the collection of that information. That basically leads to the tool creation, capacity building of the people, then cleaning of that information, making some analysis around the data, right? So I mean, that's the very expensive hurdle. If there is a system where you can basically get the readily available information, which is administrative information, not specific, but then crude numbers, core numbers, consolidated numbers, that will help in planning the intervention of that geography for the geography. So yeah, I mean, it is important that and I always look for small scale solutions. Creation of the POCs would be important. But as I mentioned, that the Delta system which we created, that was outcome of an POC. We identified a problem statement in the ecosystem, then we tried to look the solutions or options where we can handle the solution to most optimally, not 100%. Yeah, it's again, and I would say I started this project in that was my brainchild, and I started in 2017 when I presented the concept, right? And it's been 7 years. The system is still evolving. We are evolving. We identified that there are problem statement. For example, now I'm giving an example where most of the partner organizations on ground struggle with the funding options. Now, funding is that while they reach out to some agencies which are big names in the philanthropy, they request for the sustainable development goals alignment or progress on those, right? And if you look at the intervention which we are doing on ground, we definitely are intervening the same parameters which SDGs try to address. The only difference is that we have not localized those SDGs in terms of our definitions. If there is a connect, there will be a solution for the funding challenges which these guys are facing. So yeah, I mean, this is the major challenges which I see, and the solution would be experimenting out POCs, collaborative approach by using the readily available solutions, not going for the big shots at one.
Great. That's valuable advice. So I have many other questions that I would love to ask, but I think it's time to present some of the questions that our audience is posing. So if I could just pick up a few. So Karuna, the first question is for you. It would be great to hear from Karuna if a human-centered design, HCD approach, has been adopted in their work, especially since their work focuses on road safety and people, quote unquote, at its core. It would also be interesting to hear from her on how the organization was able to build their infrastructure to be able to engage with data science effectively.
Sure. So, yes, one of the key sort of philosophies for us is to sort of, look at things from a human-centric perspective. And one of the key examples of that is the tactical redesign work, which we do. And if I quickly explain, tactical redesign is just a very quick, cheap way of redesigning an intersection or any high fatality zone with using cones, paint, and barriers. So what our team of urban designers does is they look at the geometry of an intersection. The way we weave data is that we conduct roughly 6 studies on that intersection, and we look at their traffic volume, the speed analysis, the conflict analysis, all of that to say what kind of conflicts are there on that intersection or on that stretch, and what redesign needs to happen. And we take that to people. We take that to children. If it's near a school zone, we ask them, what do you think should work here? And one of the key concepts with which we work is modal equity, so that the roads are not there for just cars, it's for pedestrians. It's for children who are walking on those roads. And we go to those, vulnerable road users, to cyclists, and ask them if we will make these changes. What do you think? Would it work? Would it not work? We do a quick sort of, a survey with them and ask different questions about the designs that we have. We also use technology to then, to see how those designs would work. Would it reduce conflict? Would it increase conflict with different sort of, vehicle users which are there? And then we do that with the government departments, with the road owning agencies, whether it's Public Works Department or the National Highways Authority of India. We keep that trial running for 1 month. We again use AI-based technology to calculate the reduction in conflict. We document all of that, and then we take that to the government and ask them to make those changes permanent. And we have done that now across the country on multiple roads. So, for example, in Delhi, in Rajghat, on the Outer Ring Road in Delhi, in Maharashtra, on National Highway, on Signature Bridge in Delhi, at multiple places we've done that. And it has really helped us to keep people at the core of that particular, intervention, because it also helps us understand what would work for them, and therefore what would they prioritize. And as a principle, what we do is we create cycle lanes, we create, islands and spaces for them where they can walk, which reduces the exposure of people while they are walking. And we include them while painting the roads so that they also feel the part of the process. More often than not, what happens is when a tender for a flyover comes, it just comes because, people are feeling the queue length is too long, the cars are waiting for too long, and therefore let's make a flyover. We reverse that whole process. We go talk to the people who are living there. What do they need? What would help them use the road more effectively? And then design it with them. And when we have that buy-in from them, and we have the, enough proof and evidence by way of the intervention that it has worked and the conflict has reduced, we then take that to government to make that permanent.
Great. Thank you. Thank you so much for that answer. Uday, I think the next question is for you, specifically for the LLM-based chatbot. So the question is how can we improve the usage of chatbots for ASHA workers, as they mostly use the keypad phones?
Yeah, good question. So the trial that we are currently working on, it's not rolled out everywhere. It's a pilot project that's running in very specific sites, and there we have a tablet for the ASHA. So it's an Android device, and there's another platform called Smart Health, which the workers also use, which was also another project from the George. And we've added the chatbot as another layer into that app. So it's a decisioning, like clinical decisioning software, or an app for the ASHA workers to use. And when they interact with the patient, so they know all, like when was the last time they met with this patient, and what was what information to gather, and specifically in a pregnancy scenario. So the proof of concept is very, very tightly defined, and even the use case is very tightly defined from a pregnancy perspective. Like all the guidelines that the system reads from are local and national guidelines from a pregnancy perspective. But the beauty of it is it can be scaled. The whole system is very scalable. So let's say we want to scale this to other disease areas, other states. The solution is very easily scalable, and we'd be looking to launch the appropriate devices. If this works, then it has to be done from a device that's up to people. An emerging trend, though, right now, again, some early indicators we're seeing is this system is still, internet dependent, but given that's an issue in a lot of low resource settings, right, in India. So an idea that we want to look at in the future is also, can this be done in an offline manner? So that's also an interesting question for us to be thinking about.
Great. Thank you. Thanks for that answer. Akhil, a couple of questions for you, but the one that I liked the most was about the Digital Personal Data Protection Act. So it says, with the new Digital Personal Data Protection Act 23, collecting beneficiary details is becoming a challenge. How can we ensure that data analytics does not face hurdles in the coming days?
Right. This has been a topic of discussion on most of the programs recently, right? So, I mean, yeah, of course. I mean, see, the biggest, I would say, prominent challenge is the same that, when you reach out to, a particular household and ask for a particular information, it is really difficult to, convince, because there are so many surveys which has anyways already been undertaken over there. So, with reference to this protection act, what we tried to do, we tried to, avoid all those particular So, see, at the end, what we need is we need to identify the gaps and the entities which basically are fitting in that parameter, what we defined as in success parameters, right? So we don't need a particular I would say ID proof around that information. So what we do, we create pseudo IDs for the ecosystem, because a program is already created and running in the geography. There would be different programs. Health ka bhi chalega, and education would also be there, right? But then if pseudo ID we create and we geotag that household, at least that information is sufficient for us in terms of identification of the that particular household, right? And plus we consolidate the information around parameters. Number of household in this geography needing water connection, there would be 15 households. There would be 20, and then it's purview of administration, because we closely work with the administration, and the information is important for them, and where they can leverage this information as a consolidated number, and then Gram Sabha, Gram Panchayat will act as a bridge between them. So yeah, I hope that answered anything.
Got it. Yeah, thank you so much. So Karuna, Uday, Akhil, we've gone a bit over time, so sorry about that. So I think we'll wrap up this session, and we'll proceed to the panel 2 discussion now. But I just wanted to thank you so much for your time, taking the time out of your day, and sharing some very valuable some very valuable insights, and answering our audience's questions with very specific examples. So thank you so much for that. It was very valuable and enriching.
Anirudh, before we end, can I just take one smile of all the panelists?
Sure.
Thank you.
Thank you, Anirudh. Thank you.
Thanks so much.
Thank you.
Thanks, everyone. Cheers.
While the transition is in process, I would like to share a Mentimeter. And Anirudh, if you could talk about it whenever I share a question, it would be great. Are you okay?
Yeah, sure.
is in the chat.
So, Rupa, could you explain the Mentimeter, please? Should I open it?
No, yes, please. So the link is there. The participant, the attendees need to just open it, and I'll share the screen. They can see a question and they just need to pick one answer that relates most to them. I'll share my screen.
Sure.
Hope everyone can see this. So the question is, what brings you here? Why did you attend this webinar? And there are 3 options that you can see while voting. Please pick one that relates most. After 30 seconds, I will change the screen and you will be able to see the second question. I would change the screen now after 10 seconds. So the second question is, what category would your organization fall in? So whichever organization you are part of, if you think it's an academic institution, please pick that. Okay, nice. 5 more seconds. This is the last question. If you think, would you like to be part of CDSSI communities of practice, brainstorming and sharing best practices with other social sector organizations? Please choose with yes, no, or you would like to know more. Having these responses, we'll take 2 more seconds and then we'll stop. Thank you very much, everyone. I'll stop sharing. I need to go over to you.
Thanks. Thank you, Rupa, and thank you everyone for answering the questions. With that, we'll now go into the second panel discussion. Just a second. Thank you. So our second panel discussion today will delve into the field of, or the topic of, data-driven solutions and their role in addressing development challenges. So specifically, we'd like to explore how data science and data-driven solutions can be employed to tackle some of the most pressing development challenges that we face today. What we'd like to do today is to seek insights from our panel of experts on the kinds of products, including data-driven solutions, tools, technologies, and services that they and their organizations are working on to address these development challenges. And also, given the collaborative nature of the projects that they're working on, we'd also like to understand from them how they work with multiple stakeholders and how they work with multiple beneficiaries to increase the uptake of their products and make sure that the intended outcomes and impact is being achieved. So we're privileged to have a dynamic group of panelists with us today who are committed to developing cutting-edge solutions. So let me introduce Soma Dhavala from Wadhwani AI, who serves as the Director of Machine Learning. We have Sairaj Reddy, who is the AI product manager at Karya, and Senthil, who is the CEO and co-founder of SaveLife Private Limited. So thank you so much for being here today, and thank you for taking out time out of your day to participate in this. And I'm sure this is a very promising discussion, and it'll be very illuminating for our audience. So without further delay, I'll dive into our first question. But before that, if I could just ask each one of you to give a quick introduction of yourself and of your organization, the work that your organization does. So we can start with Soma, please.
Good afternoon, everybody. Thank you for the opportunity and listen to the kind of insights that our panelists are sharing. My name is Soma. I work for Wadhwani Institute for AI. It's a not-for-profit organization, and we primarily use AI as a leverage to work in areas of social impact. And we work in healthcare, agriculture, education, and a few others. These are large three verticals we work on.
Thank you. Sairaj, if you could introduce yourself, please.
Yeah, hi everyone. Thank you for inviting me, and it's really great to be here. So I'm Sai. I work as AI product manager at Karya, and Karya is a non-profit which is basically connecting AI-based work to most poorest people in India to help them move out of poverty. So if you look at the AI industry currently, right, it is over $100 billion industry where a lot of benefit or profit go mainly to the people who build AI and who own the AI product, but not so much for the contributors who collected the data and feed the machine learning or AI algorithm, right? And at Karya, we want to essentially, hopefully change this economic model in a way that if we can channel some of the money AI industry is generating to the poorest people in the country by providing them data annotation jobs or data collection jobs with fair wages, and I mean with 10 times the minimum wage that most government provide. So this is what we do at Karya. I'm really excited about the rest of the webinar.
Thank you, Sairaj. Senthil.
Hello everyone, myself Senthil Kumar. I'm a co-founder and CEO of SaveLife Private Limited. at SaveMom, we use a lot of government data, especially like a pregnant woman related data. These data are ideally sitting in the various government portal. So we have built our AI platform. It's called SaveMom. What we are doing is with this data set, we massively train a model with a massive pregnancy data set specific for the Indian pregnant woman. With our AI model, especially in a public sector hospital, we are predicting the high risk pregnancy in a first trimester itself. So conventionally, high-risk mothers are identified in the second or third trimester, but pregnancy itself a limited window of 9 months. So if you find a high risk at seventh or eighth month, even if you provide medicine, nutrition, reversing the high risk is very challenging. So what we are doing at SaveMom is we are predicting this potential high-risk mother in the third or fourth month, and we start recommending a personalized nutrition for them throughout the pregnancy. Our goal is whenever a mother who are monitored by SaveMom enters the labor ward, they should be entered as a low-risk mother and have a happy and safer delivery, and we ensure that no mortality happening for the mother and baby. And recently, we are actively working on the baby side also for providing a 1,000-day care. Yeah, and I'm very happy to be part of this discussion, especially the country like India, we have so many people, a lot of data, and if the data is used well, we can create a massive social impact in the country. Thank you.
Great. Thank you, Senthil. Thank you for being here. So what I wanted to start with was if all of you could shed some light on some of the specific benefits that your target beneficiaries have derived from your data-driven products, services, or overall solutions. So if you could just shed some light on that with the specifics of the benefits that that the target beneficiaries have derived. So if I could request Soma to start, please.
Yeah, sure.
Absolutely. Okay, I think Soma would like to maybe
Soma, yes,
go
please.
first. Oh.
Thanks.
Yeah. I'll take three specific examples, but generally the framework where AI makes sense is I call framework. Replay, which is a typical, like a vertical scaling instead of like 10 users, 100 users, 1,000 users, right? You develop the application once and you can use it many, many times and different people. The other is like reuse. It's like a different instance of the same idea. Let's say if you're developing an application for, let's say, in a healthcare setting, and you roll out or pilot it in one state, you go to the other state, maybe language is different, but mostly technology remains same. It's not as trivial as plug and play, but that's like another use case. The other is like repurpose. For example, the foundational idea could be, let's say, recognition of certain objects in the image. Maybe the context changes, but you have the entire machinery, plumbing is done. So therefore, feed the different data, slightly change the problem, and all of your tech investments kind of pays off. In that sense, AI is a very kind of a tech leverage solution space. As a result, it's also costly to build. But for you to reap the benefits, you have to have a little bit of patience. And if these three angles are covered, the reuse, replay, and repurpose, then the tech as a leverage pays off. If not, it can become costly and you don't see dividends of investing in this technology. I'll take a couple of examples. Let's say one in agriculture, where we built a computer vision application to let farmers get a proper advisory, science-based advisories, which in this case means that looking at the infestation of a cotton farm or a cotton field, based on the infestation, can you generate an advisory which is, for example, approved by institution like ICAR? If not, it can lead to inadvertent usage of pesticides, either wrong application or high dosage, leading to suboptimal use of the inputs. In this case, the benefit is to save input cost. The advantage could be more than the second order effects could be in the environmental conditions. Because of the right optimal uses of pesticides, maybe you are saving the land, the soil rejuvenates, so on and so forth. They're like second and third effects. The other effects could be, because you're saving the money, ultimately it could lead to saving the cost, and maybe the produce is better. Even better if you're somebody that's using organic chemicals, right? They can actually get better value. This is in the context of agriculture. Again, you develop the solution once, you can roll out this solution to anywhere cotton is grown. Therefore, the economies of scale will make sense. There are a lot of limitations too. I'll get to the later point of time. The second application is in the context of education. Now we understand that according to the ESO reports, child literacy is very, very poor. those who are at, like, say, fifth grade, they can't even read at a second grade level, right? So we developed a solution called oral reading fluency, where we use AI speech recognition techniques to understand where children are struggling, or where certain remedial interventions need to happen. Now, in the typical classroom setting, it's like 1:1 ratio, right? Every teacher needs to pay attention to the student. In this particular case, AI can massively scale. You can conduct one-on-one assessments between AI and the child, and the teacher can look at the report. Oh, this is where the student is struggling. Let me give remedial content, so on and so forth, right? As we speak, for example, we already rolled out almost like 1 million assessments were already done. This is possible because this is a in some sense like a software solution which can easily scale, and it's customizable too. The third application is like what I spoke earlier. In general, like chatbots, generative AI. I'm picking generative AI because we're also seeing exciting applications of generative AI. Particularly when the question is about access to expert knowledge, whether the access to, let's say, agronomist to a farmer, or a doctor to a patient, or an expert teacher to a student, regardless of who that expert is and who the beneficiary can be. Chatbots can be a medium to make this expert curated content accessible to the end user. And we see three applications: one in education, like generating remedial content in the context of agriculture. We see application of chatbots, etc., to deliver curated advisories to farmers. It could be at like weather, it could be about pest management, or it could be about a grievance redressal system, like my money did not come, what should I do, so on and so forth. In the context of health, like what I mentioned, like custom solutions for ASHA workers, Anganwadi workers, so on and so forth. These are the kind of applications of AI we see. Of course, I just gave a cursory view. There are a lot more, but I'll pause here and pass on to the other panelists to share their views.
Great. Thank you so much for the very interesting use cases and applications, and we'll delve deeper into them through this discussion. Sairaj, if I could request you to.
Yeah, absolutely. Given Karya is mainly a data collection company, and we do this as inclusive as possible. So a lot of machine learning models today that are out there are very biased. One example is gender. If you look at any speech recognition system that are out today, they may not be very inclusive or responsive to women speaking through these systems, simply because there is biased data of more men speaking, especially when you I'm not talking about English, right? I'm talking about languages like Telugu, Kannada, Hindi, and these and there are automatic speech recognition systems for all these languages. Okay, so through Karya, we are able to bring more people who are not just poor and who are not just in poverty, but also have been marginally backward in the society, right? And this means more women and also people who are disabled, and also those from lower caste, who have been systemically, not benefited, and we try to provide opportunities in a way everyone is included, and that's where our impact also is reflected. So doing so, it also means that we collect inclusive data. And that means better data, and that means you are caring about everyone in the society to contribute to better model, right? And that the primary benefit, I would say we are achieving. But on the other hand, Karya is not just a data collection company. We also build AI product for nonprofit who aim to amplify their solutions through AI. And this would mean a lot of our clients who are in the education sector, who are in agriculture, similar to what Wadhwani does. But in case of education, we have a client, non-profit client, who is looking at automating worksheet solutions that are shared on WhatsApp. Okay, these primarily for grades 1 to 5, and these worksheets are fairly very straightforward. You would just pick the right answers, or you would just circle the right object, match the following and things like that. And so these images, a teacher would receive like hundreds of them on a WhatsApp group, and they would have to evaluate, spending too much time on evaluating them and providing a feedback to every side. So this nonprofit is looking at automating these grading solutions. Grading overall. So we work with them very closely in building these AI solutions, and in turn, the teachers save a lot of time, and this automation happens on WhatsApp. That means the user experience is more friendly for both teachers and the students. So yeah, so this is one use case I think would be useful to start off with.
Thanks so much, Sairaj. And it's great to hear about the focus on data quality and especially the focus on inclusion of marginalized individuals and communities. Thanks for sharing that. Senthil, if you could share some specific benefits that the beneficiary groups have
Yeah.
derived from this.
Yeah, so when we deployed in all this remote areas, so there are two challenges we see. One is like the mother, there is no mechanism for the the government or even a hospital to ensure that the mother is doing the regular monthly checkup, the antenatal checkup. So there is no tracking, there is no mechanism if the mother is misses those checkup. And when this mother coming as a high risk mother after missing couple of checkup, when they come as a high risk mother, this facilities does not have a gynecologist who can help her and guide her. So most of the time, those high risk mother who's coming at a very late stage of the pregnancy is asked to go to the district hospital. So the district hospital is typically 60 to 100 kilometer away from the villages or the PHC where they are. So most of this mother never go for this follow up checkup because for them visiting the district headquarter that itself very new experience, a lot of travel for them, so they may not go there. And here what happened is when this mother become very complicated, admitted in the PHC for a delivery, then they will send them in the ambulance for the delivery, and during that time itself a lot of mortalities are happening. Okay, so then other angle, especially for the health workers who want to track the system everything, they have to use so many tools and government portals, even a hospital system. There is an electronic medical record. This all need a lot of human data entry. So for the health worker, the challenge is, will I give a health services to my customer, or I will do a data entry? So that is their challenges. So the data also not feeded to the system, and system is not that effective. So our idea is, can we bring a AI here and a combination of IoT and AI, where all this data collection happens digitally with no human intervention, using a wearable and devices, and the data can be directly fed into the software, no human entry, which increase the quality of the data. One of the important thing to build any AI model is the quality of the data, because your bias or detection, everything is purely based on the what data you gave and trying this data and try to build the model. Now, with the model, what we have done is we start predicting those mother who might misses the checkup or who might be high risk at very early stage. And we even integrated our system with the e-Sanjeevani, like it's a central government teleconsultation platform. Now, the system flagged the high risk mother, and those high risk mother is followed up to visit the PHC. And now, instead of going to the district hospital, they can visit the PHC and have the e-Sanjeevani call, where the district gynecologist available for them. This method alone is able to save a lot of mother who are dying in the complication at the time of delivery. And this model is very effective. Like a lot of state government we are deploying, bureaucrats, especially district level bureaucrats, they are really liking the transparent system. Recently, with our AI model, we have uh, implemented a system where all this government beneficiary, like a nutrition kit or the financial support, what the government is transferring to the mother, it is really reaching them or not. such a transparency the higher authorities, bureaucrats are expecting. With the system, we could able to deliver that the mother getting a nutrition on time, and the financial support is reached to them. So this is where our tool add value to this hospital system.
Great. Thank you so much, Senthil. I think it's a great application of IoT and data analytics, and I think it adds a lot of value to the MCHN space. So one theme that that's standing out, that's quite prominent, is that all of your solutions involve a lot of collaboration with stakeholders, be it with farmers in the case of Wadhwani AI, or with teachers for Sairaj Reddy, and of course what Senthil had mentioned, that there's a lot of collaboration with healthcare providers and the government as well. So my question regarding that would be, what is the approach that you adopt for one, working with these stakeholders, and two, ensuring that there is uptake from the beneficiaries, from the intended beneficiaries? So Soma, if you could share some thoughts on that, please.
Sure. No, it's right. I think what personally I'm also realizing is that operating the space, no single individual or organizations cannot solve the entire problem. And so a consortia or partnerships is the way to go. We just need to figure out what is the contribution by each of the members in that particular consortium. It's something that we need to figure out. But that aside, to me, I think the fundamentally it boils down to building trust. No, technology is secondary. For example, if you want to work with a farmer, maybe it's free for them, but why? If you are giving an advisory, why should I use you? Who bears the consequences? Particularly AI technologies like faceless technologies, right? I mean, it's a machine is predicting a decision or a value or an outcome. So where is accountability? I want to see people behind it. Therefore, while building the solution, the solution must induce trust, or establish trust between the technology provider and the beneficiary. Second, value should be seen. Whether in some cases it's very hard to see or the returns immediately, but we need to have that kind of a plan. And there should be some incentives to adopt. Either it's a part of the education or a coaching or a nudging, or by convincing other people that if you use this is a value that you see. In some cases, it's not obvious. Particularly, fields like agriculture, right? The return is not obvious. There is no instant gratification. So therefore, even as a solution developers, right, we have to have patience. Even like donors, we have to have patience. Given that the crop cycle, like typically 6 months, it's not like e-commerce where you can see the results immediately. Not possible. So therefore, evaluation even has to happen over a period of time. Could be 3-4 cycles. So trust, reliability, and bringing accountability to a decision. That is very, very critical. So this must be even baked in the AI solution development, which is very different from how you develop a typical software solution. To me, this is a very, very fundamental design construct that must be understood by everybody, including the farmer. What if the decision goes wrong? Who can they rely upon, right? So in that sense, we build a tiered system, a system of systems or multiple models, not single model, not single AI solution. You have a fallback mechanism which takes care of such situations, better yet prevents such situation from happening. These are my kind of approaches to solving a particular problem.
Great, thank you. And as you mentioned, sometimes impact, or in most situations, impact wouldn't be instantaneous. Yeah. So what is the approach that one adopts for measuring that long-term impact or outcomes?
Yeah, right. I think we divide the problem into proof of concept or pre-proof of concept, then testing, passive piloting, active piloting. So at least initially we have to be very sure that the ML model is working, or whatever the technique is working. It can happen in silico based on ground truth data that we collect, followed by control setting. Then in other words, you slowly relax the condition. You should have a high degree of confidence the moment you kind of wanting to deploy at scale or in a real use cases where users can bring in lots of scenarios. Interesting. I can give you a couple of examples. So we have to graduate the product and handhold the solution so that when it actually meets the rubber, as they say, we must be sure that what are the potential failures of more, so on and so forth. It's a graduation, not a quick fix. And we need to, most importantly, we have to have observability. If mistakes happen, where they're happening, why are they happening? Do we have the ability to fix it, either technical or programmatic? I think with this kind of defensive mechanisms, observability, defensive mechanisms, we can be reasonably sure that we can walk in, and with observable metrics, we know what's working, what's not working. In some cases, no, it's a discovery. Unlike typical software, right? Are we solving the right problem? By deploying early, we also know, are we solving the right problem? If it's not correct, we have to pivot. So in that sense, maybe you're using the wrong metrics to begin with. So therefore, we have to iterate and pivot if required. So it's a long-term game, and we have to have different stages and right evaluation metrics, right impact metrics, and a lot of times, no, sometimes it's not even possible, because for these things to make sense, we have to have a complete digital ecosystem. A lot of times we walk in a non-digital fashion. Therefore, even if you want to understand the impact metric, it's not possible. So only reasonable degree of confidence we will have in the active piloting setting, where you're controlling the environment, and hopefully it will take some time. And by the time the ecosystem is mature enough to capture those, plant those sensors, observe and monitor and evaluate and iterate.
Great. Thank you. Thank you so much for that explanation. Sairaj, the same question. What approach has worked the best for you for collaborating with multiple stakeholders, such as teachers and other stakeholders?
Absolutely. Without any collaboration, we wouldn't exist and, or make any progress, right? And so collaborations have been very unifying, have created synergies, have created a shared passion and a sense of passion. So I think they have been very helpful, especially when we work with nonprofit, because their problem is inspirational in a lot of ways, and we try to amplify their impact, right? And we also work with big tech companies like Microsoft, Google, and others, including Wadhwani. I think we work with Wadhwani AI also in collecting the data, and so our approach is simple. It's basically trying to understand the data requirement our clients have, and try to break that data collection problem into a very simple, manageable task for our workers who may be, not so literate or may know their language very well, So we see a lot of prominence in language technologies. So what I mean by language technologies are the automatic speech recognition system, or it could be NLP-based models that require a lot of regional data, and we thankfully have access to a lot of people across the country. We have about 30,000 workers who are fluent in their own language and can speak their language, right? And what we do is we reach out to these communities. We tell them about the opportunity to collect data while doing their primary job. It could be a construction worker, or it could be a mother at home, or taking care of children, or it could be farmer worker out in the field, right? So all of them are good demographics of Karya workers who not only do their job, but also use Karya platform to earn more money, right? And also contribute to the impact by reading out simple sentences in their language, or taking pictures, or it could be data collection in the form of reading about an image that's in the platform, or that's in their smartphone, and whatnot. Okay, so yeah, I mean, there have been a lot of stakeholders here, like one being the most important one, being the data contributor, who see the need, and also we pay them 10 times the minimum wage. So and the learning curve, I think, to our surprise, has been very low in actually doing this data collection job. It's fairly straightforward, and we also ensure the user experience is good for them, right? And our approach is to reach out to communities, is to reach out to nonprofits who want to employ their beneficiaries for data collection jobs. We reach out to a lot of nonprofits who are working on poverty space, because this is an additional source of income, another source of income for those in poverty. So yeah, that is the most important part of our work. And the other being, gathering requirements from our clients or those who are interested in building AI models, right? And it's important to let them know the impact they are making in collecting the data, and also in making sure the quality of data is good. So we have challenges with data quality. So what we do is hire professional validators to make sure the data is clean, and also you provide feedback to the workers to do better, right? And we are also trying to reduce the cost of validation, professional validation, because it costs a lot of money. So we are using AI to actually be able to distinguish between a good recorded sentence or data versus a bad record in the data, right? And so we are automating some of these by employing AI. So yeah, this has been our approach, and we are always like yeah. So I think that answers your question.
Yeah, absolutely. Actually, someone had a question about data accuracy and validity, how you ensure that. So I think you've already answered that. Thank you for that.
Yeah, no worry.
Senthil, so you had mentioned that one often faces some pushback from the healthcare providers side, especially when these kinds of complex solutions are being deployed. So if you could shed some light on what is the approach that has worked for you for
Yes.
collaborating with stakeholders.
See, actually, like when we initially deploy this solution, like there is a lot of resistance because it needs some changes. Like the workflow has to be changed. So of course, there are a lot of challenges. Even initially, like when we deployed, see, our model is like the integrity of the data. The data is really coming from the pregnant woman, and no one is manipulating the records. Like because otherwise, in a traditional software in data collection, the challenge is people they can type whatever they want and claim that the mother visited, this is the vital data, this is the checkup information. So everything they can manipulate it. So in our system, we built a IoT based model where the data should be captured through the mother. Like they can put the device on the mother and then it captures, and that data will be stored on them. But when we deployed, we see a lot of challenges because sometimes the data looks very similar. A lot of mother same data. Some of the mother we misses their fetal heart rate, which is a very core parameter. So when we went to the PHC and we have found that this health worker, they are very smart enough. So what they do is they don't interact with the mother. Now the system is not allowing them to manual data entry. So what they do is they use the device for all these colleagues in the PHC itself. And whenever they run out of enough women, they do it for the men. That is where the fetal heart rate is missing. And for 200, 300 mothers, they use 5 to 6 people. Repeatedly, they use the device for this people to fill the 200 mother data. So this is where our challenge is, because they don't want to do on the ground follow up and checkup, and mother is not also coming here, and the data is after deploying the solution also data has a lot of challenges for us. Then here what we realized is we worked with them, we understand our pain point, like why what not motivating them to do this one. And they told currently they are all temporary staffs in the system, and their salary is very minimal, it's 3,000 to 4,000 rupees in a month they used to get the salary. So they one of the health worker told, when I started, was so passionate, I'll go door by door, educate the mother, bring her to the hospital, everything I do. But later my other peers, the colleagues, they told don't do this, try to manipulate. It's an Excel sheet. So we just to fill the data and upload it to the portals, the different portals. So this is where I started doing it. So here we come up with a very transparent incentive model, where every checkup they collect from the right mother, and that checkup they'll get 20-30 rupees as an incentive. So if you're able to do for a 200-300 mother in the PHC thing, their additional incentive is like 5,000-6,000 rupees. This is an incentive we introduced, and other than that, another model we introduced is a wearable device we developed and given to the mother. Now, the wearable device can capture the entire month data, 1 month data, the wearable device can capture. And if the contact is established between in-person contact, either in the home of the pregnant mother or in the PHC, then our medical device, along with the software, it will authenticate that this is the right pregnant mother, they are capturing the data. And a whole data capturing is digital, no human intervention, no manual record. And by doing this they are getting additional incentive also. So when we incorporated this solution into their PSC, this is where we see that the data the resistance is very less, because our idea is now you don't need to do a lot of multiple portal, using multiple portal, or don't need to use multiple devices, manually recording, typing it, that and all not required. It's all the technology is helping you to reduce your work burden and incentivizing for using the technology. So after basically we reduce their day-to-day work and then incentivize that. Because of that, no, the adoption started faster. Similar for the doctor side also, because this doctor they don't actually want to go from a district to the PHC for every visit, and then we proposed that our model allows you can still be in the district hospital, but through our portal you can review the patient, consult with them over the online, and give all the prescription to them all digital, and it really reduced their travel this one. And doctor were contributing, see more data, creating impact. There is some kind of a recognition model we introduced in the system. So by doing all this reward kind of a mechanism and reducing the day-to-day work using technology and incentivizing. See, currently, if you see all startups, that's what they do. They'll make you to transfer money super fast, no exchange, and they incentivize with the cashback. So when we go with this kind of approach, we see a less resistance, and startup people start using it, and on the go, all cashbacks are gone. Similar way, you can even still reduce the incentive, but still people are adapted to that. They find it's faster and easier for them to do their day-to-day work. So this model really worked for us, and we try to replicate the model in different state where we are deploying. Yeah, thank you.
Great. Thank you so much, Senthil. Yeah, I think these kinds of tactics for incentivization and the strategies of communicating the benefits of the solution, I think they can be really valuable.
Yeah.
So I wanted to take some audience questions as well. And thank you so much for posting your questions, everyone. This is not directed to anyone specifically, so I'll just open it up to everyone. This is about emerging technologies. So the question is, over the last couple of decades, we have seen a few tech waves, be it big data, smart systems, IoT, blockchains, crypto, etc. And now it's AI/ML. How much of the tools are sticky in the sense that they're here to stay, as opposed to just riding this wave? So if anybody's interested in taking up this question.
Even I want to go with that. See, it is all convergence now, because computing in the day start, human want to replicate himself. That's what all the initiative. So whatever technology we have talked about, this all helping to build that really powerful useful AI models. So that is where we are in the edge of it now, and we are building more super AIs to solve human problems and assist them. So this is going to be there's no option. This is not because if you take IoT, or if you take VR, AR, now all merging with this AI capability, now this all previous technology, big data, you see this all to build this current AI, the technology was introduced. So those are small tools helping to build this powerful larger language model. It's a massive, capable AI, multi-purpose AI. So that is what we have reached now. But this is going to be stay. It won't be replaced by someone. It's going to be stay and become more powerful in future. And all this task specific AI will become a general purpose AI, and now it can really replicate human activity, support the human and growth aspect. Even in my opinion, this AI can do a lot of social related thing where humans are not interested, or it is very expensive when we deploy human, and AI can really create such an impact in their social context.
Thank you. Does anyone else want to take that?
Yeah, I just want to give my perspective on that one. I mean, a lot of things that we are seeing on definitely remarkable progress is happening with respect to videos, audio, content generation, right? Certainly exciting, but you also have to take that with a pinch of salt. I mean, we can associate sort of like delusional intelligence to what these guys are producing. At the end of the day, these are simply approximate retrieval machines. So therefore, at best, based on the current kind of advancement that we see and the kind of current criticism that we see of these technologies, as long as it's like entertainment purpose, it's fine. You can use it. But if you're trying to use this kind of technologies for like responsible and in some sort of like critical situations, right? They have to be used as a co-pilots, not completely delegate the responsibility or offload the responsibility to these technologies. Case in point being chatbots, right? So my take is that they have to be grounded in reality. If not, use them as like co-pilot. In other words, the ability for human beings to use these technologies not so much of delegate like personal assistant, but more of like a co-pilot. Meaning, you still have to have control on. In other words, you shall have the ability to verify the response produced by these technologies. As long as that agency is with you, it's fine, because they're like your friends. They can come with a lot of ideas and so on and so forth. I'm sure that a lot of research is happening in basically controlling these technologies, but things will progress. But at this time, we also have to be wear the hat of responsible users of these applications.
Great. Thank you so much. So yeah, I think we've gone a bit beyond the scheduled time for this. So I think we can wrap it up. But before that, I just wanted to thank Soma, Sairaj, Senthils. Thank you so much for participating in this. And it was a very illuminating discussion. And I personally am taking a lot of insights from this. So it was great learning for me as well. Soumya, if I could just hand it over to you for some closing remarks, please.
Before that, may I please request one screenshot with all the panelists? If you can just smile. Thank you very much.
Thanks. And thank you so much to the audience as well for all your questions and for participating. Really appreciate it.
Thank you, everyone. Thanks for inviting me. Pleasure to discuss.
Thanks, everyone. Thanks so much.
Have a good day. Thanks.
Thank you. And sorry, if anyone is working for a nonprofit and is interested in speaking with me, please reach out. Bye.
Hi, everyone. Thanks so much, Anirudh. That was a really, really insightful discussion. There were lots of important points made. Some of them actually correlate very closely with the work that CDSSI is already doing, about staying true to the mission, starting small, about collaborating with stakeholders and co-creating with them, about data quality as well. So while we're on that subject, I'd just like to tell you a little bit about what CDSSI is currently working on, because they tie in with a lot of what we've just talked about in the last hour. We have currently a CDSSI fellowship running. We've just onboarded 7 teams of fellows for a year-long fellowship. They will be developing digital public goods to address the needs of the social sector. And these DPGs will be accessible to the general public and other development sector stakeholders as well. We're kicking off the fellowship with an orientation on March 15th in Bangalore, which all of you all are welcome to come to, if that's possible at all. Then we also have the CDSSI hackathon called Code for Change. We're running this in partnership with PRICE, which is People Research on India's Consumer Economy. The idea is to get data science enthusiasts to create innovative solutions for a social sector problem and to make a positive impact on the lives of marginalized groups. We have over 100 individuals currently working on our solutions. At a hybrid event in April, the top solutions will be presented at a particular convening, and all of the solutions would, of course, have been selected by a panel of eminent AI and data science experts. Then we have something called the Storytelling Project, where we're looking at collating inspirational stories of the use of data and data science by social purpose organizations. And I think a lot of what was talked about today actually fits into that. We're trying to talk about how data and data science use can, transform the operations, the impact, the efficiency, the scale, the framework that Anirudh talked about at the beginning of the convening today. So we're documenting that, but not in a research format. We're doing it more of a human interest and journalistic storytelling format. And we would love to hear from all of you if you think that your story merits, it fits into that framework of an inspirational use of data science story, and we could tell it in that project. We're also doing a data maturity assessment. This is for Indian social purpose organizations to develop a deeper understanding of their current data readiness and the underlying barriers that they might be facing in their effective use of data. We will be sharing findings of this data maturity assessment with the entire ecosystem to be able to help all of you all effectively allocate resources and address any gaps in data usage. That's pretty much it. This brings us to the end of today's convening. Thank you so much for your time. We're very, very keen to continue this engagement via communities of practice. So we will be reaching out to all of you shortly, based also on your responses to the earlier poll. And we really hope you find this engaging, and please do send us your feedback and thoughts, and please get back to us about where you would like to be involved and how. Thank you so much.
Soumya, before we conclude, I think there's a short poll that the admin would like to us all to answer. Thank you, Agrima.
Requesting everyone to please fill the poll forms. If you have logged in from mobile, you can see the 3 dots, and there you would be able to see the poll. We will keep the poll open for 30 more seconds, and then we'll close.
Thank you all. Have a good
Thank you,
evening.
everyone.
Okay, I think we should get started now while we wait for the others to join in.